Hi everybody, my name is Stephen Black. I am the Director of Behavioral Health for Major Health Partners, also the Director of Health Equity. And today I'm sitting here with one of our newest mental health providers at Major Health Partners. Kim, would you like to introduce yourself?
Yes, hi, I'm Kim McGillicudy. I'm a psychiatric nurse practitioner at Major Hospital with Family and Internal Medicine.
Excellent. So Kim and I are here today because this year for Giving Tuesday, we want to take a little bit different tack. With everything that we've seen over the last couple of years with COVID, the pandemic, just a lot of other societal factors, there's a real challenge for people accessing mental health care. And so I know from a community level, I see this a lot, but in your role, can you just tell folks what you do within Major Health Partners, within Family Internal Medicine, and why you came to MHP?
Certainly. So I came to MHP because I've always been very passionate about integrated care. So the integrated care model means that as a specialty in psychiatry, I am embedded in family and internal medicine, which makes me more accessible not only to our providing doctors and nurse practitioners, but also to our patients. And that was the important thing, I think, that we were trying to accomplish through integrated care models, that we had better access, quicker access, to be able to serve our patient population in family and internal medicine.
Yeah, so it's not the newest model, but it certainly is one that has been, I think all of healthcare has been a little slow to embrace for a variety of reasons. It's one of the reasons I came here too, is because MHP had made a concerted effort to move in that direction of recognizing that mental health care is not something that's on its own over to the side, but we all have how we are up here is a part of how we are as a person, our overall health. And so can you speak to kind of how does behavioral health impact health as a whole?
So we all have heard of mind, body, and soul. I mean, it's all one entity together. And if we're not doing well mentally, it affects our physical body. If we're not doing well physically, it affects our mental health, which is why it's so important that we work together, mental health and primary care, to be able to treat the person holistically from a medical and mental health perspective.
Yeah, so that's one of the, it's been a main emphasis for us this year, is really looking just as mental health is a part of the overall health picture, we also want to have mental health care then embedded within our primary care practices. And so pediatrics, obstetrics, family and internal medicine, if people are being seen by clinicians in any of those practices, they have access to you as an example.
Absolutely. So if you are already a patient at family and internal medicine, in OBGYN, at the pediatric office, in order to access either my services or services of one of our other two nurse practitioners that we have, you contact your family physician. That's the first contact person is your primary care, is your pediatrician, is your OBGYN. Be open, talk about what's going on in your mental health. We are here to help you. Your primary care physician is going to be your very first point of contact. They will link you to us.
Yeah, so you used what I would say is the magic A word, which is access.
Yes.
So you talked about how we've made it easier to access you as a professional. But I also know that from our community health needs assessment, that one of the biggest challenges for people to access good mental health care is finances, and that it is the primary barrier that we're seeing right now to getting good mental health care. Are you seeing that too? Is that something that you've seen as a challenge over the years?
Absolutely. When it comes to mental health, oftentimes we are going to want to see you back and keep tabs on you. Make sure we're following up in a timely manner. That can mean more frequent appointments coming to see us. That can sometimes be a barrier. So that's where financial struggles can come into place. To coming and seeing us back on a more regular basis so that we can make sure that we are providing you with the kind of care that you need and deserve. But then there's also barriers can also be financially with medications that we prescribe as well. Sometimes insurance companies can get a little fickle about what they want to cover, what they don't want to cover. So that can also be a barrier to good care. So.
Yeah, and so that's why this year we're partnering. MHP and MHP Foundation are working together on Giving Tuesday to set up a specific patient fund to help make it more accessible to get good mental health care, substance use disorder care, access to Kim and her counterparts. That's something that we really want to emphasize this year because we are seeing that we don't want that to be a barrier. Right. Sometimes people have a hard time with transportation getting to appointments. They have other barriers. We want to see if we can eliminate this one. Do you think that if folks out there give to this fund to allow others to remove that barrier to access to you and your counterparts, do you see that as being a good thing? Would that be a help?
Absolutely. Finances are a huge barrier for people to being able. It's not just a matter of us now you have access to our care. It's also a matter of being able to afford the care that is being provided for you. So yes, being able to give, being able to donate, being able to help those who need that help, is going to be important to be able to continue to drive home the message that we are trying to drive home, that your mental health is important. It's important to you, it's important to us. We want to try to eliminate as many barriers as we can, and so hopefully through some financial aid and some financial help we can do that.
Yeah, I love how you kind of sum that up, that your mental health is important to us, it's important to you. We want to remove barriers to make sure that people have access and that it is equitable to everybody to receive the kind of care that you're providing. And so any final words you'd want for our audience out here? Just please, during this holiday season, during our, just please be as generous as you can be and be able to help others who are in need of help. That's great. Well, thanks for being generous with your time, and we thank you all in advance for supporting the community and giving back. There are people that are truly in need out there this holiday season, and we thank you for your efforts. Thank you.